Are there physiological and psychological similarities between humans and animals? Or other animals, I should say. And if so, what are the implications for the diagnosis and treatment of disease? Our featured guest this morning is Dr. Barbara Natterson-Horowitz, Professor of Cardiology at UCLA, who's also on the advisory board of the Los Angeles Zoo as a cardiovascular consultant. Several years ago, Dr. Natterson-Horowitz was asked to help the zoo with an emperor tamarin, which is a very small monkey, which was in heart failure. The experience got her thinking about the different approaches that human medics and vets have to treating their patients, what conditions might be experienced by both humans and animals, and what lessons can be learned about each, or from each. She's just published a book on her research along with her co-author, the science journalist Catherine Bowers. It's called Zoobiquity, What Animals Can Teach Us About Health and the Science of Healing. And in it they discuss animal-human health connections and conditions ranging from stress-induced heart attacks to diabetes, cancer and sexually transmitted diseases. Yes, the koalas and chlamydia. You were thinking it, I know. Barbara Natterson-Horowitz is on the line from Los Angeles. How are you?
Oh, I'm fine. I'm delighted to be here.
We must start, because it so beautifully starts us on your journey about the Emperor Tamarin experience and what it really highlighted for you. You were very excited to be asked to see this little fellow, and they are very, very cute. And
Yes. I mean, I've been a human cardiologist for a couple of decades at UCLA, taking care of, human beings with heart attacks and high cholesterol. And then I had this wonderful opportunity to spend time with the veterinarians at the Los Angeles Zoo. And there, for the first time, I began going on rounds with veterinarians, and I heard them talking about, congestive heart failure and pneumonia and leukemia in patients like gorillas and kangaroos and polar bears. And so it just struck me at that moment that for all the years I've been a physician, I just never really thought about the fact that veterinarians are taking care of many of the same disorders in their patients that I was taking care of in mine. And on one particular day, as you said, I was asked to come do a cardiac ultrasound on a tamarin, an adorable little monkey. And as the animal was getting sedation, I was looking into her eyes closely, and I was trying to establish a trust bond, much in the way I would do with a human patient. But the veterinarian put his hand on my shoulder and said, "Please stop making eye contact with the animal. You're actually frightening her, and you could give her capture myopathy." Now, I had never heard that term capture myopathy before. So later on, I learned that animals, when they are very frightened, particularly when they're being chased or perhaps when they're restrained, their bodies spew out a tremendous amount of adrenaline, which can poison the muscles of their body, including their heart, and sometimes they can die. Well, what was particularly notable to me about this description of capture myopathy was that it sounded an awful lot like a human condition, which is really called, it has a fancy Japanese name, but it's basically the broken heart syndrome, a kind of stress-induced heart failure. And as I tried to compare capture myopathy to stress-induced heart failure in humans, I realized that these two conditions were very connected. But what was really remarkable to me was that although veterinarians had been diagnosing, treating, and even preventing capture myopathy in their patients for decades, it was only about 15 years earlier that we physicians had recognized it as a syndrome. So I thought, my gosh, what else do veterinarians know that we physicians don't, and how might we improve medicine by bringing the fields closer together?
So as well as feeling like a bit of a twit as you're sitting there kneeling down and crouching and trying to comfort this terrified little creature until someone said, actually, you're going to give the thing a darn heart attack, as well as having that slightly embarrassing moment, you have this real kind of moment of awareness of an opportunity.
Well, yeah, I mean, this whole experience has been just an exercise in humility. As a physician, unfortunately, our profession can be a little bit snobby, and unfortunately, I think many physicians have not really adequately recognized veterinarians as clinical peers. And, veterinarians are trained in much the same way we are. I think they actually have an advantage that they learn comparatively. So when they learn about heart failure as first-year vet students, they learn about heart failure in a mammal and in a reptile, and in a fish even. And we, of course, just deal with Homo sapiens. But I've just learned so much. I mean, the way that veterinarians look at psychiatric disorders in their patients, for example, is very different and yet very effective, and I think there's lots that our psychotherapists and psychiatrists and patients could learn about their approach.
That comparativeness is very interesting. I think it was when you were doing an ECG on a python that you had quite an insight into how it might be relevant to another human condition.
Yeah, I mean, there have been many experiences. Every time I get to spend time with veterinarians, I learn something that I can apply to a human condition. Yeah, there was an experience with where I've done an echocardiogram on a snake, and I looked at the way the ventricle contracts. Of course, reptiles only have three cardiac chambers. We have four, and but they have a single common ventricle, that is the lower pumping chamber. And the way the reptile accomplishes allowing the oxygenated blood to head to the aorta and the less oxygenated blood to go, into the pulmonary circulation gives us clues about how we can handle certain patients with human heart failure. The problem is that we physicians are not trained comparatively. So my experience is that when I lecture to medical students and even senior physicians, they're very surprised to learn that lions and tigers and jaguars get breast cancer, or that koalas get chlamydia, or that rhinoceros can get leukemia. It's surprising to them because we physicians have gotten very, very accomplished and very deep in certain fields, but unfortunately we've gotten very narrow as well.
I think the clue that it offered to you was for children who might be born without a septum between their ventricles.
Mm-hmm. Yeah, I mean, the insight was, well, yeah, there's a congenital form of congenital heart disease in which there's a single ventricle. And there are a number of strategies that cardiologists use to improve the function of that single ventricle, and sometimes it involves using specialized pacemakers. And there are questions about how to optimize how that pacemaker should be programmed. And so looking at the function of a python's heart, I mean, reptiles have been around for hundreds of millions of years and have had a chance to sort of, through natural selection, optimize the functioning of a single ventricle. I wondered, my goodness, what might we learn on the human side for a young patient with a single ventricle from an animal who's functioning very well with a single ventricle?
Back to the stress-induced heart failure and the capture myopathy of that little cute guy that everyone was worried about. The broken heart syndrome, this can be applied to extreme stress situations affecting humans. I think the natural disasters such as earthquakes is an example that you've given.
Yeah, we have several examples in the U.S. of individuals having either stress-induced heart attacks or even sudden death in response to natural disasters, terrorist attacks. After 9/11, we saw an uptick in certain kinds of heart disease and even sudden death. And certainly in 1994 here in Los Angeles, we had the last major earthquake, and there was a statistically very significant increase in the number of heart attack-related deaths in that period. But it turns out there's this other form of stress-induced heart failure that can happen when, it's been reported when someone is left at the altar, or when they lose their life savings with a roll of the dice. Something very intense and negative, seeing a loved one killed, for example. So, yes, intense emotional experiences can trigger catastrophic cardiovascular events in human beings.
Is it the same effect? Is it a surge of adrenaline that overwhelms the system?
Yeah, there are multiple mechanisms through which it can happen, but one of them, yes, does involve this high circulation of catecholamines, of adrenaline, that have this adverse effect.
Often with cardiologists we're thinking heart attacks and heart failure, but you learnt a lot from the creatures also about fainting.
Yes, well, the one creature that I learned about fainting from was my own 12-year-old daughter. In the midst of doing this research, my daughter, who had been begging me to get her ears pierced for a long time, I finally agreed, and I took her to a friend's office, a physician. And as the ear-piercing gun was coming closer to her ear, I watched her watching the gun, and all of a sudden she got very sweaty and she keeled over. She had a fainting episode. And I remember wondering, my goodness, why on earth do we humans have this response? I mean, you would think that in response to threat there would be the fight and the flight response, but why a faint response? And that led to some research talking to wildlife biologists and veterinarians, and I learned that many animals, particularly juveniles, in response to predatory threat, they actually slow their heart rates down. The veterinarians call it alarm bradycardia. Bradycardia is the medical term for a slowed heart rate. And the reason that animals do it, it's seen in fish as well, is that it keeps the animal very, very still. A kind of pre-fainting state makes it impossible for a fawn to rustle in the bushes or a fish to be flopping in the water and to, signal to the predator where he or she is. So it has this adaptive anti-predation effect. And so my theory is that it has remained in the gene pool because it has been so successful in allowing our ancestors to avoid predation.
I wonder if there's a psychological component along with the physiological. Sometimes you will faint in shock, say, and it is a way of literally making you unconscious from whatever it is that has caused that.
Yes, absolutely. I think this is part of that same sort of complex. And of course, these days, stress for us might be learning that Wall Street has collapsed and we've lost our life savings. Of course, in millions of years before, that would probably have been some predatory stress. But the neurological reflexes remain the same.
So here you are after this experience, really realising that animals suffer from some of the same conditions as humans, that vets and doctors really don't share experiences enough, and you hinted at that idea of a snobbery, as if there's some kind of hierarchy of medicine involved. Where has that taken you? What are some of the findings or the things you have learned from learning more about the animal kingdom and the conditions they have that are similar to us?
Yeah, I've had many insights which have helped me with human patients. I mean, on the physical side, of course, learning that, breast cancer, particularly the BRCA1 mutation, leads to breast cancer in certain dogs and in big cats, as I mentioned. That's been really eye-opening. But beyond the physical, it's been very interesting to learn that animals can suffer from what I had assumed previously be uniquely human psychiatric disturbances. So OCD, obsessive-compulsive disorder, certainly anxiety disorders like separation anxiety. And then most interesting to me were learning that animals can have eating disorders.